Hello guys, welcome to my channel Tooth Fairy. In today's video, we are going to discuss analgesics. So this topic is really important. As we know, as far as ACJ exam is concerned, this is really important because it will cover your prescription part, your management part, and as well as your treatment options as well. So because whenever you have a question, like you should know whether you have to prescribe NSAIDs or you have to avoid NSAIDs or opioids are indicated or contraindicated. So for that, you should know details about analgesics. So let us discuss about analgesics. So let's start. Now, what are analgesics? Analgesics are drugs which are used to achieve analgesia or relief from pain. So, patient is given analgesics depending upon the characteristics of pain. Now, before we move on further, like in discussing these things, let us discuss briefly about pain. We'll come back to this slide later. So, let's discuss briefly about. Now, why it is important? Because first of all, this will help you in the diagnosis part. Like whenever you are given signs and symptoms in the history and you have to make out a diagnosis, like whether this is pulpitis, irreversible pulpitis, or abscess, or acute pain, chronic pain. So these are very helpful in those scenarios as well. So let us discuss briefly about these. So first of all, pain is classified according to the duration. According to the duration, the pain can be acute or chronic. Acute is when there is sudden onset and the pain is for a very short period of time. The duration is short. And why does it happen? It happens mainly because of tissue damage. And its examples are irreversible pulpitis, dental abscess, or pain after surgical tooth extraction. On the other hand, chronic pain is spontaneous in nature, is of longer duration, more than the acute pain, and it can be because of the tissue damage, but more often this is because of damage to the nerves. And the examples of chronic pain are TMJ pain, migraine, or trigeminal neuralgia. So you should know which conditions in dentistry, which kind of pain will one encounter. Second is, it's not very important, but still let's have a look at it. According to the frequency, it means how often do you experience pain. It can be constant, it can be frequently, or it can be intermittent. So according to the frequency. Next, this is according to the severity of the pain. Now, what is severity? It means intensity of the pain, how intense the pain is. According to that, we can divide it into mild, moderate, and severe. And pain is judged on the scale of 0 to 10. I'm sorry, I've written 1 to 10, but it is 0. So on the scale of 0 to 10, whereas 0 being no pain and 10 being a very worse pain, extremely severe pain. So this is according to the severity of the pain. So now we're going to discuss about the mild, moderate, and moderate, severe, or severe kind of pain. So let's move further. Now, as we have discussed that patient is given analgesics, keeping the characteristics of pain in mind. First of all, if the pain is mild to moderate, now what are the examples of mild to moderate kind of pain? Example, chronic periodontal abscess. Okay, chronic periodontal abscess, tooth eruption, new tooth eruption. In chronic periodontal diseases, the pain is usually a dull and moderate kind. So in this scenario, acetaminophen is recommended. Now, acetaminophen has some properties which are important to us. And what are those properties? A, it has antipyretic effects, that is fever reduction properties. B, an analgesic effect, that is it will give us relief from pain. An important thing to notice here is it does not have any anti-inflammatory effect. It does not have any anti-inflammatory effect. So yes, in case of fever, you can use it. In case of pain, you can prescribe it, but not in the inflammatory conditions. Now, even for children, acetaminophen is a drug of choice because this is considered very safe. and it is given as 10 to 15 mg per kg, because as you know, in case of children, it is calculated, the drug dose is calculated according to the weight of the child. Now let us discuss about the indications and contraindications of acetaminophen. Indications are: acetaminophen is a drug of choice for mild to moderate pain. Second is, whenever NSAIDs are contraindicated, we'll prescribe acetaminophen. Then this is safest in pregnancy and kids. And next, in ortho treatment, acetaminophen is preferred. And contraindications, the first and foremost contraindication is allergy to acetaminophen itself. If a patient is allergic to acetaminophen, we will not prescribe any acetaminophen to that patient. Now, severe liver damage and alcoholic. Now, severe liver damage and alcoholic are kind of relative contraindications. For that, you have to read the case history really well. So these are not absolute contraindications. Just remember this thing. So now, if the pain is moderate to severe. Now, in what cases the pain is moderate to severe? Example, acute dental abscess, ANAG, or extensive surgical tooth extraction. In these cases, pain is moderate to severe. And as we know, in case of moderate to severe pain, acetaminophen alone is not sufficient. So we have to prescribe a medicine, a drug which is having more effect than acetaminophen. So what all conditions we have to consider? First of all, we'll see if the patient is healthy and there are no contraindications to NSAIDs, then we will prescribe NSAIDs. Example, ibuprofen. Now, any NSAID here is acceptable. When it comes to NSAIDs, there is no order of preference of drugs. Like, you can prescribe ibuprofen, you can prescribe naproxen, you can prescribe mefenamic acid, but you should know the dose frequency, the maximum daily dose of that drug. So remember one thing, once we discussed a video, the title of which is Memorizing Pharma. In that video, I have shown you how to make some tables and how to memorize these drugs by making those tables and memorizing it over and over again. So if you are doing that, then it is really good. If not, you might have some another methods, some other ways to remember these things, but you have to learn these things. This is really important. So please do that. If you haven't seen the video, please go and check out the video. The title is Memorizing Pharmacology, Memorizing Pharma Drugs. So please look for that. The main thing is that you have to know about all the drugs and their dosages, maximum daily dose. That is really important. Now, if the patient is allergic to acetyl salicylic acid or any other NSAID, or there is contraindication to NSAIDs, give the patient acetaminophen and codeine combination. Okay. Now, properties of NSAIDs. These have analgesic effect, antipyretic effect, and anti-inflammatory effect as well. Acetaminophen did not have any anti-inflammatory effect, but in case of NSAIDs, these have anti-inflammatory effect as well. And specifically in case of aspirin, it has antiplatelet effect as well. Now, what are the indications of NSAIDs? First of all, there should be moderate to severe pain. Secondly, there should not be any contraindication or allergy to NSAIDs. So this is the indication for NSAIDs. Now, what are the contraindications to NSAIDs? This is really important. What are the contraindications to NSAIDs? First of all, allergy or contraindication to NSAIDs itself rules out the use of NSAIDs. Second is asthma, aspirin-induced asthma or nasal polyps. So in those scenarios, it is not prescribed. Then is GIT disorders such as peptic ulcer, gastrointestinal bleeding, inflammatory bowel disease like ulcerative colitis and Crohn's disease. So it is contraindicated. Next is bleeding disorders, example hemophilia, Next is patient taking anticoagulants. Now this is very important. Whenever the patient are taking anticoagulants like warfarin, NSAIDs are not prescribed, but this is not the case with antiplatelets. So if the patient is prescribed antiplatelets, NSAIDs are not contraindicated. Only and only in case of anticoagulants. So learn these things and take care of these things and know the drugs which are anticoagulants and which are antiplatelets. This is important. Next is severe liver or renal impairment or end stage liver or renal disease are contraindication to NSAIDs. The next is third trimester of pregnancy. In first and second trimester of pregnancy, you can still prescribe NSAIDs, but in case of third trimester of pregnancy, NSAIDs become category D. So this is not at all. This becomes the contraindication. You will not prescribe it. Then there are a few medications with which NSAIDs are not prescribed. Example, if a patient is taking lithium, concurrent use of lithium, then patient is not prescribed NSAIDs. Patient taking anti-neoplastic dose of methotrexate. Now this is also important. Anti-neoplastic dose of methotrexate. Whenever it is specified in the history that patient had some cancer and patient is taking methotrexate for that cancer condition, only then NSAID is contraindicated, because methotrexate in low dose can be used for arthritis as well. So in that cases, NSAIDs is not a concern. So remember, high dose or anti-neoplastic dose of methotrexate is contraindication for NSAIDs. Low dose or dose for arthritis is not a contraindication. Next is in congestive heart failure. This is absolute contraindication. Patient taking digoxin. This is absolute contraindication. Now next is if the patient is hypertensive and patient is taking medication, antihypertensive, and it belongs to these three classes: ACE inhibitors, diuretics, and beta blockers. So ACE inhibitors, example is like enalapril, captopril, and for diuretics it is like hydrochlorothiazide, and beta blockers such as propranolol. In these particular classes, you will limit the use for 4 days or less for NSAID. So it becomes a relative contraindication. So whenever you have patient with hypertension history and patient is taking antihypertensive drugs, and those antihypertensive drugs belongs to only these three categories, then either limit the use for 4 days or less, then it is not a contraindication, then it is not a first choice, then the drug is not the first choice, but still you can prescribe NSAID for 4 days or less. But if in this case NSAIDs are prescribed more than 5 days, more than 4 days, it is wrong. Okay, then it is contraindicated. So in this scenario, again, I'm repeating this thing because this is really important. First of all, antihypertensive drug first, and then secondly, look for the drug, whether the patient is taking ACE inhibitor, diuretics, and beta blockers. If patient is taking these three classes of antihypertensive drug, then look for whether the use is for 4 days or less. If it is for 4 days or less, then it can be prescribed, then it becomes a relative contraindication. NSAIDs can be prescribed. But if it is for more than 4 days, then the prescription is wrong. It cannot be prescribed. It is contraindication for more than 4 days. And secondly, if let's say they have given calcium channel blockers such as diltiazem, then and given NSAID prescription, then it is okay, because calcium channel blocker is also kind of antihypertensive drug, but it does not have any kind of interaction with NSAIDs. So that is comparatively safer. So this is really important. That is why I was stressing it again and again. Okay, then moving on. I hope this is clear. Next. Now, very important, if patient is allergic to aspirin or any other NSAIDs, you cannot give any other NSAIDs. Aspirin-induced asthma, no NSAID is used. Now, there are some basic general guidelines for analgesic prescription. That is like, first off, we know that whenever patient has a pain, you have to eliminate the source of pain whenever possible. Secondly, you just cannot have one prescription and prescribe it to everybody. So these are individualized based on patient's pain and medical history. So there is no one answer for every question. That is why we say take care of the medical history, go to the medical history carefully and the condition of the patient and the pain's severity. According to that, individualize the prescriptions. Then this is really important, you have to maximize the non-opioid before adding opioid. So whenever you are prescribing combinations, maximize the non-opioid before adding the opioids. Next is severe pain. In case of severe pain, either you can give high doses of NSAID, example ibuprofen 600 mg if there is no contraindication present, or you can add codeine 30 to 60 mg to either NSAID or acetaminophen depending upon the history of the patient. Another is oxycodone can also be added to acetaminophen as well, so it makes it Percocet. Then even bupivacaine can be used to achieve a longer duration of anesthesia. Now the thing is that in case of opioids, just remember the combinations like Tylenol 1, 2, 3, what are the different strengths, and in case of even oxycodone and acetaminophen, what are the different strengths of oxycodone and acetaminophen in Percocet. So that is important. Please do learn about those things as well. So next, opioids indication and contraindication. So we know that opioids are strong analgesics, so we will use them in severe pain. And on top of that, they have antitussive and antidiarrheal properties as well. So for us, the main indication is severe pain, we'll choose opioids. Now, contraindications are whenever patient has a severe respiratory disease like COPD, chronic obstructive pulmonary disorder. In those cases, you will not prescribe opioids. Opioids are contraindicated in those conditions. Example is chronic bronchitis, emphysema. So just always, know these terms really well, because if they have mentioned these things in the history, then you will not prescribe opioids. So what happens in chronic bronchitis, as we know that inflammation of bronchial tubules happens here, and this causes shortness of breath and coughing and mucus production, wheezing. So that is how this is respiratory trouble. And even in case of emphysema, the alveoli or the alveolar sacs, air sacs are damaged, which also causes shortness of breath, and because of which there is respiratory depression can happen. So severe respiratory diseases like COPD, chronic bronchitis, emphysema, opioids are contraindicated. Next is severe inflammatory bowel disease. This is severe ulcerative colitis and severe Crohn's disease. Now, important here is severe. Severe is very important, because if it is normal, then only NSAID is contraindicated. But if they have mentioned severe as well, severe ulcerative colitis, so then then opioids also become contraindicated. So that is the thing you have to remember. Now next is patient taking MAO inhibitors. What are MAO inhibitors? These are monoamine oxidase inhibitors. And these are antidepressants. Example, phenelzine, isocarboxazide. Now remember this thing, you have to know these things as well. You should know what drugs are under MAO inhibitors, so that you can know if there is any interaction. In this case, only meperidine is contraindicated. Now, whether the patient is taking meperidine concurrently or patient has stopped within 2 weeks, like within last 14 days, you cannot prescribe meperidine, so it becomes a relative contraindication for meperidine. Now, history of substance abuse or addiction to opioids. Now, here it becomes a relative contraindication. So whenever you have an alternate option available which can be given to a patient, let's say NSAIDs can be prescribed to a patient, in that case opioids become an absolute contraindication. But when the patient has a contraindication to opioids as contraindication to NSAIDs as well, in that case we do not have any alternate treatment. So in that case, opioids become a relative contraindication. That means you can prescribe opioids in that case. So whenever history of substance abuse or addiction to opioids, check the history really well, whether you can prescribe NSAIDs or not. If you can prescribe NSAIDs, then opioids become absolute contraindication and you have to avoid them. If you cannot prescribe NSAIDs, then these are relative contraindications and you can prescribe these. Okay, so next is concurrent use of alcohol or CNS depressants such as barbiturates or benzodiazepines. So just remember these things. Now, opioids are of two kinds, we know, natural and synthetic. In natural, we have codeine, oxycodone, morphine, hydromorphone. In synthetic, we have meperidine, fentanyl, pentazocine. Now, why are we discussing this? Because this is really important. Whenever you have allergy to, let's say, codeine, it contraindicates the use of all other natural opioids as well. In that scenario, you will choose synthetic opioids such as meperidine. So this is why you should know which all opioids are in natural or which are synthetic. Then next is tramadol is not a true opioid, but tramadol is considered safest when the patient are not able to take opioids in combination with NSAIDs or acetaminophen. Okay, in that case, tramadol is safest. So just take care if ever you see tramadol in the options and in the case history. So important here is, if we have discussed it, now special consideration is codeine in Canada can be given to kids if the age is more than 12 years. So less than 10 years, less than 12 years of age, codeine cannot be given to the children. But in case of age more than 12 years, codeine can be prescribed if need be. Now next is in pediatric cases. Let us discuss a bit more about it. As we know, in pedo patients, acetaminophen is the drug of choice. And if the pain is higher, is of higher intensity, ibuprofen can be used. And if required, codeine can be added to aceta or NSAIDs in children above 12 years of age. And even in case of geriatric patients, older patients, we know acetaminophen is again the drug of choice. It is comparatively safer than all other drugs. Now, one thing more, if a patient is old and patient has a history of gastric bleeding and acetaminophen is insufficient, in those cases, celecoxib, which is a COX-2 inhibitor, is preferred over all other NSAIDs. So just take care of this thing if you have celecoxib in the options and the rest of the scenario is given somewhere in the case history. Just remember this thing. Now let us discuss in pregnancy. In first and second trimester, acetaminophen is drug of choice in mild to moderate pain. Even in third trimester, acetaminophen is drug of choice in mild to moderate pain. Now, NSAIDs are not considered favorable as they reduce the prostaglandin synthesis. However, these can be given as ibuprofen is category B during first and second trimesters. So comparatively safe in first and second trimesters, and NSAIDs can be prescribed. We're talking about first and second trimester here. Now, oxycodone is also preferred over codeine in case opioids are to be prescribed. But when it comes to third trimester of pregnancy and the pain is moderate to severe, NSAIDs are not prescribed in that case. So NSAIDs are in category D in those scenarios, and those are not prescribed. Even aspirin is avoided in pregnant as well as lactating patients, and even meperidine is also avoided in lactating patients. So safest options are acetaminophen and oxycodone, and that depends upon the severity, and NSAIDs depending upon the trimester of the pregnancy and of course the severity of the pain. So this was all about analgesics. Please hear me out. I want to say something. I have been getting some requests lately for ACJ classes, so I'm planning to start them. It can be personal classes or one-on-one sessions as well. So if any one of you is interested, please message me or email me at toothfairyacj@gmail.com. I will give the link in the description, or I can leave my email in the description box. So kindly reach out to me if any one of you is interested, and the charges will be bare minimum. Let me assure you about that. So thank you so much. Thank you for watching, and please do check out the other videos as well. Thank you.